Okay, everyone, it's 2 o'clock, so let's go ahead and get started with the first of 2 full general membership meetings of the Texas Balance of State Continuum of Care. Holding at least 2 full membership meetings is a requirement of HUDs. So that's the first reason that we're holding this meeting today. The second, and I believe the more important reason, is that this allows us as THM, the COC lead agency, an opportunity to reach out to a greater number of people and COC members and to hear from a much greater number of our members, which are you. And we hope that you will provide some input today during the meeting and ask questions as they come up. So to ensure that that happens, I want to go over the method by which you will be asking questions. So I want to make sure that everyone knows how they can fully participate in this webinar. So let me show you this screenshot. Now, unfortunately, we can't unmute everyone on the call. This is because we receive a lot of feedback when we do so, and it makes conducting the meeting, well, virtually impossible. So what we rely on is the control panel that GoToWebinar offers and the function in that control panel of asking a question. So these are some screenshots that will show you how you can do that. So when you logged on to this webinar today, you should have seen something like this control panel, which I'll circle for you. That is the tool that you'll use to ask your questions. So look for that on your screen. Hopefully it's on there. And once you locate that, then what you can do is locate where you ask the question. So unminimize that box, expand it, and when you have a question or a comment that you want to make, type it into this field and then hit send. And when you hit send, you'll see that it has been sent to the presenters, and we can see the question and the comment, and we will get to that as soon as we can within the presentation today. So please provide your input that way today, and ask questions as they come up. We definitely want to hear from you. Okay, let me get back to the agenda. Okay, so we have a total of, looks like, well, a little over 60 people joining us today. And we're grateful for the large turnout, but because of the large turnout, we're going to have to handle the introductions a little differently than we normally do. Typically, I do a roll call of each of the attendees to the meeting, and sometimes if we have time, we allow people to say hello to the group. With this large group, that would take a long time, and so I think it would be best if we handled this in a different way. So what we're going to do is I'm going to present you with some registrant information that will show you the coverage within the Texas Balance of State. Okay, so first of all, we had a large number of people register. Actually, right before we started, I saw that there were 97 people registered, but earlier today, I pulled down a report, and you can see that we had a large number of people registered then. I think it was 95 at that time. The people that actually attended the meeting, they will be on our attendee record, and you'll get a record of that when you get our notes. So you can see that we have quite a few people joining us, well, quite a few people that registered, and we do have quite a few people joining us. We now have 63 on the line. And if you look at our coverage by region, you can see that we have a lot of coverage throughout the Texas balance of state. Some areas are covered a little bit more than others, but you can see the cities that are represented here by their region. I don't think that we have anyone from the Panhandle, but that is because their consortium meeting is actually on this day. So hopefully we can eliminate that conflict in the future. But we do have good coverage. And I want to show you one more thing to demonstrate who is on the call. I think it's always interesting to look at this on a map. And you can see whenever I pulled this map together, we had 86 registrants, and this is based on those numbers. So you can see we have people from all over the state joining us, all the way from Odessa, all the way across to Beaumont, down to Brownsville, and up to Dallas. So we have quite a large coverage area. We do within the Texas balance of state anyway, but we do have a lot of people joining us for this full general membership meeting today. And again, we thank you for taking the time to join us. So what we're going to do today is go through the agenda, and we're going to go through some basic concepts. And I think it's important that we do that because of the new attendees, people that have never attended any of our monthly webinars. And it's good for them to review this information, but it's also good for those that have been attending monthly to re-review this information so they can learn more about the Texas balance of state in preparation for a vote that we're going to have, well, 3 votes that we're going to have later on in the meeting. So, before we get to that basic information, I'm going to get into the section for COC participation. So in the past few months during our COC board meeting, I have talked about using a listserv or some type of tool to communicate with the balance of state members. And this is something that we're doing more and more of, and we expect to do more and more of throughout the year. We're trying to encourage more participation from balance of state members. And one of the ways we thought we could do that or facilitate that participation and become more efficient with our communication is to roll out a listserv tool. And we thought Google Groups would be a good tool to use for that. We use Google for all of our email and many of our other applications here at Texas Homeless Network. So we began testing that, and we told our members during our last 2 monthly board meetings that we would be testing it with them. But as we tested it in-house, we noticed some potential problems with Google Groups, and we determined that it would probably be too confusing if we started rolling out to our members. So I just want to show a screenshot of what we had been seeing. So the part that was confusing was this visit this group button. As we would invite members to join the Google Groups, they would get this email. And if they clicked on visit this group, Google would try to get them to sign up for a Gmail account. This is something that would be a potential problem for our members. So we have, after our internal testing, we decided not to roll it out. So we are currently looking for another Listserv tool to provide for our more efficient communication. This is something that we do have to roll out soon because right now our distribution list is maintained by me. So the members have to rely on me having the time to send out the information, and they have to rely on me putting their name on the list. With a listserv, we'll have the ability for any authorized THN member to send out messages to the group and for you to manage your subscription to the COC listserv yourself and not be reliant on me for that. So we will continue to explore this option and hopefully find something very soon that will provide for a better communication with you, our COC members. Okay, so we're going to get into some of the THN basics, and there is one person on the call today that's going to be helping me with this, and that's Mary Dotson, our COC manager. She will be going over some of these basics with me. We'll be taking turns throughout the rest of the agenda in explaining some of these items before we get to those votes that I talked about earlier. So I am going to allow Mary to go ahead and jump into what is a COC.
Hey, Eric. Hello, everyone. I think we're actually on THN Basics. Who is THN?
I am sorry I got ahead of myself there. You were right. We are on THN Basics. But that is your section, so you can go ahead with that, Mary.
Yes. All right. Hello again, everyone. Eric and I wanted to, again, kind of go over some of these basics with you guys because some of you are brand new to the COC. Others who've been here a while may not have a full understanding of the difference between THN and the BOS COC. And Eric, you know what, if you could give me screen control, I'll go to THN's website. Okay, maybe he's not on the call at the moment.
No, I'm sorry, I am now. I had to go close the door down the hall.
Right. Oh, okay. If you could give me screen control, I will show the THN website.
Okay, here you go. I am sorry for that.
All right. I thought this might be a good way to show you who THN is. This is our homepage and about THN. We are a statewide organization. Our mission is to provide solutions to end homelessness in Texas communities through education, resources, and advocacy. So we do a lot of trainings, technical assistance. We try to have materials available both on our website and at the end of your phone call when you call us. We try to be a great resource for you. Brief history of Texas Homeless Network, incorporated in 1991 by a couple of state departments, or when a couple of state departments were getting together to form the Texas Interagency Council for the Homeless, or TITCH. Some of you may know that group. That's right now about 14 state agencies that meet regularly to coordinate planning and services to address homelessness across the state. And so THN has been an integral part of the TITCH since its inception. And then you'll see a little bit down here, this is some of our 2013 point-in-time count data. That's one thing that THN helps all of the communities across the state to provide a statewide point-in-time count. So we work with the other 11 COCs in the state on that kind of thing. And so you'll see we have tabs here on our website about education piece of what we do, training, development. You'll see here our annual conference on ending homelessness, which I'm guessing many of you have attended. Just a little plug, this year it will be in October in Corpus Christi, and you'll see. We're accepting applications to present. We're also having our healthcare summit, Supportive Housing Equals Healthcare Summit next week, and our Homelessness Awareness Day on the afternoon of April 2nd. We also have an annual Case Management Institute, and we do SOAR training to help people apply for SSI and SSDI. So many, many things that we do formally that fall into that education category. Resources, similar thing. We have forms, data, sample documents, the COC map, all kinds of things that you can use. And advocacy, in this tab, you'll see there are lots of very recent data because the Texas legislature is currently in session, and we've got our policy priorities listed here and some handouts about the most important issues that THN is working on during this legislative session. And at the top here is our Homelessness Awareness Day Toolkit. So for those of you who are planning to participate in Homelessness Awareness Day next Thursday, there's a toolkit for you to get started and help you know what to do. So, and then there's our Balance of State COC tab, which, because you all are in Balance of State COC, you might be most familiar with. And then there's THN membership. That is an opportunity for you to support the work of THN and get discounts on some of our trainings if you are a member. It's different from being a member of the BOS-COC, which you automatically are because you are in the geographic area. And there's our blog. So we blog about important things that are going on that are very timely. So again, overall, THN as an organization tries to do all kinds of things that support you guys as service providers and ultimately all of us working together to help the people in the state who are experiencing homelessness to get out of homelessness or not fall into homelessness in the first place. So, Eric, I think I can turn it back to you to go to the next step.
And I want to take some time to ask if there are any questions at this point, and remind you, if you do have questions or comments, write them in using your control panel like we showed you earlier. We definitely want your input throughout this meeting. I'm going to go ahead and talk about Texas Homeless Network's statewide activities and THN's Balance of State COC activities and how those relate. So I put together a little diagram here that I'm hoping helps explain this relationship. So we often get asked when we go to communities or we're meeting with groups, what does THN do and how does the Texas Balance of State Continuum of Care fit into what THN does? To us, and especially to me, it seems obvious what we do, but I've learned that it's not obvious and it's not very clear to even a lot of our THN members and I think our Texas Balance of State members. So we're going to try to do a better job over the next few months of explaining how that relationship works and what you as members should expect from us, you as COC members, and what our entire THN membership group should expect from us. So the important thing, I think, to know about Texas Homeless Network is that here at Texas Homeless Network, we serve the entire state of Texas. We serve every community and coalition that is striving to end homelessness. And we do that through our core service areas: education, resources, and advocacy. Many of you have gone to our annual conference. That's an example of education that we provide. Resources. Many of you have called us and asked us for point-in-time information, information about homelessness throughout Texas, resources such as intake forms. So we provide those not only to the Texas Balance of State, but to the entire state of Texas. And then advocacy, which Mary touched on earlier. This is something that's really busy here in the state capitol right now because the ledge is in session. So we're doing more and more in that area as well, but we also try to advocate locally with you to help you out with your local governments. So we do this in the balance of state. We do this in Fort Worth, El Paso, wherever in the state we are needed. We have two departments within the Texas Homeless Network, and each works with the entire state. We have the Development and Training Department, and that's the department that puts on a lot of the training that you see, the webinar block talks, if you've ever been on those, the annual conference, and the Housing Summit, just to name a few of the things that they do. Now they do that, again, for the entire state of Texas, including the Texas Balance of State, Continuum of Care region. So the other department at Texas Homeless Network is the Texas Balance of State, Continuum of Care staff. And what we do is we focus on that Texas Balance of State COC region, but we do help folks and communities outside of that region because overall we are still THN. Things that we focus on within our continuum of care are these things. These are our responsibilities as the COC lead. Operating the COC, and examples of that, or one example of that, would be holding meetings like this. Designate and operate an HMIS, Homeless Management Information System. Right now, Jesus de Leon Cerratos, our HMIS manager, is on his way to Laredo to meet with 3 groups about their HMIS programs there. Conduct COC planning. This is something that we do routinely with our communities. I was just a couple of weeks ago in San Angelo and last week in Beaumont, meeting with those groups. And if we have anybody from those areas on the call, thank you for having me those last 2 meetings. And then collaborate and develop then submit applications for funding to HUD and to other funding sources. The most recent thing that we've been working with many of our members on is the Emergency Solution Grant application. So that's an example of one way that we're serving that purpose for our COC. So again, the important thing is that THN serves the entire state. The Texas Balance of State is part of THN, and our mission remains the same for both geographic areas. So I'm hoping this helps explain what THN does and how the Texas Balance of State Continuum of Care is part of THN. And we're going to make this available to you as well as other materials that might be helpful for explaining our roles. And we want to go into more detail in the future about the roles of each department and how, again, you can benefit from these departments and from THN in general. So are there any questions about that or comments? We don't have a whole lot of people writing in, even though we have a lot of people attending. There would not be any crazy question or comment. We'll take them all. But for now, we will move on. Okay, let me get back to the agenda. Okay, now we're going to get to some of the COC basics. And under this, I'm going to pass the screen back to Mary. And she is going to go over
yes, thank you.
What is a continuum of care. Hopefully you guys aren't getting dizzy with all these screen passing back and forth. But Okay, you should have the screen now.
All right, let me make it a little bigger for you. All right, so what is a COC? For some of you who are new, many of you we've heard from just in the past couple of months from community development corporations, community action agencies, area agencies on aging, those kinds of other large planning groups in communities who are really interested in getting more involved in homeless services, which is very exciting. But we have to share with them and explain to them kind of what this whole COC structure is about according to HUD. So what is a COC? Basically two different things, for lack of a better term. A COC, or Continuum of Care, can be a community-based planning network for homeless assistance. So all the people within a local community, or in our case within the entire COC, who work together to strategically and coordinatedly and effectively address homelessness. A COC is also a geographic area, and Eric will show you a map next of what the Texas Balance of State COC geographic area is. And third, kind of a more traditional definition of what is a COC now is called the COC program, and that is a specific grant-funded program administered by the U.S. Department of Housing and Urban Development, or HUD. And for entities that receive that funding, which are agencies within a COC, then their COC is required to do certain things, which Eric touched on a moment ago, all those various responsibilities that we must do as a COC because we're participating in HUD's COC program. So that purposes of that program are to promote a community-wide commitment to the goal of ending homelessness. So not so much only homeless services who are working to end homelessness in a community. We want it to be all those kinds of groups I mentioned a minute ago, plus local governments, medical care communities, school districts, almost any kind of entity you can think of in your community, law enforcement, hospitals. We all have our part to play in ending homelessness in our communities. Another purpose of the program is to provide funding for efforts to quickly rehouse individuals and families and to minimize the trauma and dislocation that homelessness causes to those individuals and families. So I love that they're not just focused on providing the funding, but really looking at minimizing trauma. Another purpose is to promote access to and effective utilization of mainstream programs by homeless individuals and families. And what that means is programs that aren't only available to or designed for people experiencing homelessness. So there we might talk about things like Medicaid or SNAP or some of those other income assistance programs or employment training programs that are considered to be mainstream, and again, not only HUD funded and not only homeless services. And finally, the ultimate goal, optimizing self-sufficiency among individuals and families experiencing homelessness so that they can become stable in housing and then from there, hopefully, become as self-sufficient as possible. So that's kind of our guiding principles for the work that we're all doing here. How does a COC work? Well, representatives from relevant organizations within a geographic area establish a COC. The Texas Balance of State COC existed probably since 1995, as long as the COC program has existed. But Texas Homeless Network took over as the COC lead agency in 2005, I believe. I say 2006, but I think it's 2005. And so that the Balance of State COC became a lot more formalized. And then over the years, We've operated as a COC according to HUD guidelines. We've had other COCs merge with the balance of state COC, so we keep growing. And HUD has increased the requirements for COCs, so our work is getting bigger in that way as well. And so we have certainly established and operated a COC for almost 10 years as THN. Then the COC selects a board to act on its behalf, and we'll talk a little bit more about that when we get into the governance charter. And of course, again, COCs carry out the responsibilities required of us by the COC interim rule. All right, that is the end of what is a COC.
Okay, and I want to make sure that we address a question that did come in when we get to why participate in a COC. So I'll remind you of that question when we get to that. But I am going to show you everyone the map, and I won't spend much time on this because I know most of you have seen this map and the huge orange space that is on this map. But I want to tell you a little bit about what this means and the history of the Texas Balance of State. So Mary is correct. The Texas Balance of State Continuum of Care actually started in 2005. It was started by our executive director, Ken Martin, and a consultant that has worked closely with us for many years, Paula Harper. And the reason they formed the Texas Balance of State was to provide support to our rural counties in Texas, and that's how it really started, providing support to our rural counties in Texas and offering them an opportunity to apply for federal and state funding that many of our large communities have taken advantage of for years. When we say balance of state, and I stress the balance, what we refer to is the balance of funding that left the state or left the area and went to another region of the state each year. And that term is primarily used to talk about HUD Continuum of Care funding, but it could also be applied to state emergency solution grant funding and other funding sources. So the reason for starting the Texas Balance of State was to offer support and an opportunity for that funding. So it started out in 2005. There were about 170, a little over 170 counties that first signed on, and that first year, that's what Ken and Paula did, is they drove around and met with several communities and encouraged them to participate, and really that whole first year, that's what they were getting, is that participation, that agreement to participate. Then I came on in 2006, and I continued that work, and then we started bringing in other communities. One of the first that we brought in that was from a different continuum of care. It was a continuum of care that merged with us. That was the Longview, Gregg County area. The Northeast Texas Continuum of Care, I believe, is what it was called at the time. We met with them, and they merged with us, and they're one of about 7 continuums of care that have merged with us since 2006, and that's primarily why we have grown to 216 counties. The latest area to merge with us is the Southeast Texas Continuum of Care, which is, I believe, I'm going to mess this up, I believe this area right here, and that's the folks in Beaumont and Port Arthur, and I know I'm leaving out one other city, Orange, that have more recently joined us. So that's the reason we've grown throughout the years, and that's also the reason, one of the main reasons that our overall funding requests have grown, and the funding that we received have grown. It's not just due to us growing, though. I do have to toot our horn. I think we at THN and you and your communities have done a much better job of applying for these funding sources and obtaining this funding and developing projects. And I think the creation of the Texas Balanced State really helped in that. So whenever you see that map, just know that there is that history behind the map, and it's not just a huge collection of counties for the sake of being a huge collection of counties. There is a reason behind the balance of state, and there's a purpose to it. Okay, I'm going to go ahead and hand the screen back to you, but I want to make sure that we do answer these questions. So I'm handing the screen back to you right now, Mary, but if you could just hold on a second, there is another question that came in. Okay, and Andrea Wilson asked the question that we can address during this section, but there was a question from Amanda Dolman, who is in Corpus Christi and with the VA. And, oh, actually their questions are nearly identical. So I'm going to let you start, Mary, your part of the presentation, and then I'm going to make sure that we answer their questions. So Amanda and Andrea, we will definitely get to your questions during this section.
Okay, so why participate in the COC? It's certainly not that you don't have anything else to do. We know that's not the case. So 3 good reasons to participate in your COC: to plan and deliver homeless services in a strategic, coordinated, and goal-oriented way. So certainly over the past 5 years or so since the Hearth Act came out, a lot of research has been done on the most effective ways to address homelessness and prevent and end homelessness. And so we want to make sure that we're helping all of our communities within our COC to know what those ways are and how to effectively deliver those services. Secondly, similar concept, to incorporate evidence-based practices that are effective. And along with that is not just working on your local community, but us as a COC really having a direction, having certain goals that we're going to accomplish as a COC so that we're being strategic. And finally, to bring funds for addressing homelessness into the community. And we've talked about that a little bit in terms of assistance with grant application writing, identifying funding sources, and then facilitating the process within our COC for that very large pool of money called Continuum of Care program. Also, we are working toward accomplishing goals in the Hearth Act. In short, they are reducing the number of persons who become homeless for the first time and the people who return to homeless situations. We want to cut down on that as much as possible so that people don't experience that. We also want to reduce the length of time that people are in homeless situations so that our system is operating as what's called a crisis response system, and we can work to get people back into housing as quickly as possible. Of course, that's with some caveats. It depends on what their specific situation is and their needs are, but also we're getting more strategic about focusing and targeting and really helping our programs truly meet the needs of the people that we serve. And then finally, ultimately, we want to increase people's housing stability for the long term. Another reason to participate in the COC is the whole idea of a systems approach. Systems use data. So at the COC, we gather, compile, assess, disseminate comprehensive community-wide data that supports planning for future projects. I'm guessing many of you on the call today are definitely at least involved as a user of HMIS, which we at THN administer for the COC. Some of us also do some kind of COC-wide data and goal setting that's based on HMIS, but it's not done directly by HMIS users. And so we're heavily involved in using the data in all kinds of different ways. And so thank you for your participation in putting your data into HMIS. Otherwise, we couldn't use it. We use input from all the stakeholders and all homeless subpopulations within our communities. So again, this is that idea of it's not only homeless services providers, it's not only Texas Homeless Network staff, it's as many different groups in the communities as we can get to help in the effort, reflecting the broad range of homeless subpopulations, from veterans to people who are chronically homeless, families, children, youth, elderly, you name it, there's a subpopulation for it. Third, we modify our plans and goals based on what's happening in real time. And so you will be hearing from us throughout the year on different areas of goals and target setting and that sort of thing that will establish pretty much for the first time as baseline measures, and then in future years we'll touch back to those and get your vote on whether we should continue having those the same or making them different. And then finally, addressing community-wide goals, focusing on the entire range of housing and services. So again, kind of that mainstream approach where we don't want homeless services to be separate from other things that are going on in the community anymore. We want housing, affordable housing and services to be just a part of what is generally available in all communities, again with the ultimate goal of providing housing stability for everyone in our communities. So how does your community benefit? Well, more community members live in safe, stable, and affordable housing. Makes your community stronger overall. And money is spent to keep people housed and healthy rather than in crisis and using public services. So preventing and ending homelessness obviously helps the individuals and families who are experiencing that, but it also helps our communities overall. All right, that is the end of why participate. Eric, did you want to bring up the questions?
Yes, I do. But before I do that, I want to make sure that everyone is still able to view us. I just received a text from Tracy Sepulveda in Longview, and he said that there were some network problems. So can someone write in and tell me whether or not we are still coming through? This is one of the downfalls of meeting by webinar. Okay, well, we have confirmation from Brown County and Bell County and, well, many other counties. So thank you all for verifying that. Wow, they're still coming in. Thank you for verifying that you are viewing the presentation. That's an overwhelming response to that question. Thank you. Okay, the two questions that came up during sorry, I'm going to go ahead and pull this back. Actually, we'll leave it here for now. The two questions that came up earlier that I thought we might address during the segment that you were just presenting on, Mary, were from Andrea Wilson and Amanda Dolman. And let me just read each of their questions, and then we'll address each. So Andrea Wilson, and she's with PATH in Tyler. She is Tyler's representative for the COC. She asked if we could address the importance and the value of participating in the Texas Balance of State COC, even if a member's organization isn't receiving federal funding. And then Amanda's question, and again, Amanda's in Corpus Christi and she's with the VA. She asked something very similar. She said, well, she asked, what is the strategy to deal with community providers who do not receive HUD funds and do not participate in point-in-time counts, which she says can ultimately misrepresent the number of homeless people in a community. So I'm going to go ahead and answer first, but then Mary, I'm sure you'll want to add to that. So number one, why should our members participate in the Balance of State COC, even if they don't receive federal funding? Well, just like your local community, within our COC planning, we are planning for the entire COC, and we are planning with every community and every provider in those communities, whether they receive federal funding or not. So the planning that we conduct and the strategies that are developed not solely with our federal grantees in mind, but with those communities in mind, and more importantly, with the population experiencing homelessness and the subpopulations within that overall population in mind when we develop these strategies and conduct this planning. So we need input from everybody on this so we can ensure to get a comprehensive perspective in those planning sessions and a well thought out strategy for alleviating and eliminating homelessness. And then Mary, I'll let you add on here in just a second. And to piggyback on that and hopefully answer Amanda's question, how we deal with community providers that do not participate in the process. Well, obviously we start with encouraging them to participate. And I know that locally you're doing that. But what we try to do is show all providers in a community and all advocates in a community why it's important that they participate in the planning and the data collection efforts in particular, and show them what happens if they do not, and try to appeal to their sense of community and develop an understanding that the community, if they are going to end homelessness, projects have to be developed and managed that are funded from several different sources. And those projects have to coordinate their services and their housing. And you can only, as a community, you can only make real change once you have all that coordination. And we can't rely solely on our federal and state funding. We have to have our local funding. And so we have to have those agencies that don't receive that state and federal funding involved if we are going to make a dent in homelessness and then ultimately end homelessness. So those are some of the things I would say to a community that's dealing with this. And if I were to meet with a community partner who's not participating. Mary, is there something you'd like to add to that?
Yes, I was just pulling up some of the numbers that we have to show you guys, or to better illustrate what Eric's talking about in terms of needing everyone involved. I don't actually have anything on my screen, but for example, in our housing inventory, which is representative of every single housing or shelter project that we have in the Balance of State COC, we've got more than 200 projects. And so compare that to right now we only have 44 housing and services projects that are funded by HUD's Continuum of Care program. So we already know about many, many organizations within our COC that are in fact operating some sort of housing or shelter, but they're not getting COC program funding. Just another point, even on Emergency Solutions Grant or ESG funding, we just recently helped 24 groups apply for projects. So, you know, 44 COC program funded, 24 ESG program funded potentially, compared to more than 200 housing projects in our overall housing inventory. So you can see we already are trying to get a lot of involvement from groups that receive funding other than those two large federal sources. Of course, more recently, we've gotten SSVF, Supportive Services for Veteran Families. We got VASH programming from the VA. There's PATH from Health and Human Services, Runaway and Homeless Youth Act, Homeless Education, dollars. So lots of groups that we're trying to coordinate with because we know that they get some kind of funding related to homelessness, but ultimately overall it's very much what Eric said. We're all working together as small groups and larger groups to end homelessness throughout our state. And we can only do that when we're all working together in a coordinated and strategic way.
Yes, and two quick things that came up while we were talking. We had two comments made. Michelle Normally from Women Inc., she's the executive director there. And she said this is a great question by Amanda and Andrea. And she said it's important to address this in each community because inevitably your clients in your community work with several different agencies. And it's important that those agencies and those providers are working together because they are serving, ultimately, many of the same clients. And the coordination of those services provides for a more efficient service delivery and better use of funding sources, whether they're federal or local. And then Amanda is, and I'm sorry, Michelle, I kind of paraphrased that, but I think that was what you were after. Amanda Dolman also followed up by saying, data is very important right now for funders. And if a community isn't gathering the data that is required, they could be missing out on potential funding opportunities. So she just wants to drive that point home. And then there's one more from Linda Hamlin in Midland. And she states that Midland doesn't receive funding, and I think what she means is HUD, Continuum of Care funding, but that they use the point-in-time data to justify their local needs to the community and get support for services and shelter. So all good points, and I feel like they needed to be voiced. So thank you all for participating in this. And I'm going to go ahead and move on unless there's anything else. Make sure. Okay, so we are actually to the COC governance portion of our agenda. And this is the section where we will eventually be taking votes from you on the items that are up for vote. And Mary, do you have some materials ready for the governance charter MOU and the COC board?
Yes,
okay,
I do.
I'm going to go ahead and make you the presenter again then.
All right.
And before you get going, yeah, let me say, so Mary's going to go over some of this, and as long as it's okay with all of the members, I thought we would take it item by item, and then we would do the vote after the summary. But before we take the vote, I do want to give you some time to ask questions and provide comments, so you will have the opportunity to do that, and others will have the opportunity to hear. So I'll let you go ahead, Mary.
All right. Are you seeing my screen?
Okay, are you able to see? I'm sorry.
I want to make sure, are you guys seeing my screen?
Yes, we are.
Let me just try to make sure on my own because I'm not hearing any response.
Oh, I'm sorry, we are seeing your screen.
Okay, great. All right, I'll make it bigger then. All right, so the governance charter. What's the purpose of having a governance charter for the COC? Well, in a nutshell, it's to delineate our governance structure and decision-making authority. So how is our COC organized, and who has the authority to make decisions for the COC and within the COC? So I'm going to switch to actually looking at the charter now. Those of you who have been on the past couple of COC board meetings have seen us go through this document. This has also been posted on our website for the past few months, and we did a couple of email blasts asking very specific questions about certain pieces of the charter that we wanted to make sure we pointed out to people and gave them an easy opportunity to give feedback on. And so we got lots of comments, and we do appreciate you all taking time to do that. So I've updated the date here on this version of the governance charter because there are a few slight differences from the one that was posted on our website and that we had been receiving comments on. But in general, you'll see the first part of it is the COC governance structure in general. Oh, for heaven's sakes, I see a mistake right here already. We are now, as of a few weeks ago, not 213 counties anymore. We are 216 with the addition of those 3 that were formerly in the Southeast Texas COC. So I will need to change that. But we are talking about the geographic area. We're talking about, in general, who are the kind of groups within the COC. We've got the general members, the board, the coalition representatives, the collaborative applicant, which is just HUD's way of saying the official group that can apply to HUD for funding on behalf of the COC, the HMIS lead agency, and COC lead agency. And you'll see here, I've put this one in yellow because we did redesign this org structure just a little bit from the one that had been in the charter based on some great feedback. We wanted to make sure that we were showing that the general membership of the COC is at the top and ultimately has the power, because all of you who are on the call today and everyone else in our COC geography is considered to be a general member of the COC, and you all get to vote on who the COC board members are under this charter. And so that means you get to decide who your board members are going to be that are authorized to make decisions on behalf of the entire COC. So that's a pretty powerful position, and so we wanted to make sure you were right at the top. And then under the board, there's an official, what we're calling right now, Coalition Representatives Planning Group. And just like it sounds, those people will be representatives from local homeless coalitions who work together and may form committees, or probably will form committees, to do a lot of that day-to-day work of operating and planning for the COC. And that group will also be the one that will most often send items to the COC board for their vote and approval. The other 2 bodies here are currently, those roles are fulfilled by Texas Homeless Network. So we're considered to be the collaborative applicant, or again, that group that can apply to HUD for funding on behalf of the COC. And we're also called the COC lead agency, or the COC staff. And that's because what we do is try to facilitate the work of the COC and make it easy for all of our members to participate. And of course, we're the HMIS lead agency. So we help to administer and work with our users out in the field to know how to use the homeless management information system in the best way possible. So I'm sure many of you know our HMIS team and our HMIS support staff who you talk to all the time. So that's the overall general layout of our governance structure as proposed in this charter. And so a little bit more just about who all is in that group and the kinds of things I just said. And then starting on page 3, there's some very specific details pertaining to each of those groupings. So you'll see, for example, first one, COC general membership. This just says who the general membership is and how people become a general member. And so again, we don't have any, as a COC, we don't have any strict membership requirements. You don't have to apply to be a member, you don't have to pay to be a member, you don't have to attend a certain number of meetings, anything like that. Right now, we are still in the mode of being very inclusive and wanting to involve as many people as possible. All right, and then the COC board, a little bit more details about that. This charter is proposing that the board be composed of 11 members. Of course, 1 currently or formerly homeless person at least, 5 representatives from that coalition representatives group, some additional representatives from other homeless coalitions or planning bodies that we want to make sure we've got some good size and geographic representation there, a broad range. And finally, 1 representative from the Texas Interagency Council for the Homeless. Also highlighted in yellow here, you'll see a couple of things that we have talked about changing over the past few months and through our comment period. Board members are elected by the full COC membership at the full membership meeting. We had in there that they would be elected by the coalition representatives, but that's not HUD's intent. HUD's intent is to have the full membership have the opportunity to elect the COC board members. So you all will get an opportunity to do that at the fall general membership meeting if you all approve the charter today. And we also talked about aligning the board member terms more with what would work for our fiscal year instead of a calendar year. So change that language to the terms will begin on October 1st of one year and end September 30th of the following year. And thank you to all of those folks who wrote back and commented on that. Here is a description of the Coalition Representatives Planning Group. It's pretty much what it sounds like. Local homeless coalitions will select a person that they will serve as their official representative to the COC. And for those of you who just filled out ESG applications, you know how important having that person participate in the COC meetings is. TDHCA uses that in their scoring of your ESG application. So that's just one reason to participate. But we certainly hope that you know, you'll also participate because you want to work with us and join the effort. And so a few things we've changed here to align with the board member terms. We're saying that the representatives terms will also start October 1st of one year and end September 30th of the following year. And we've added the provision that they could be selected in the summer or the fall. We had it as the fall when terms were beginning in January. But that's the only change from before. And so again, that's going to be our broadest group besides the general membership of representatives who are in this COC governance structure. Committees, I had a slight wording change, just grammatical error, but I thought I would point it out because that was a change that's different from the one we had posted on the website. Just saying that committees might make recommendations to the representatives planning group, and then those recommendations may be placed for voting approval by the COC board. Ad hoc committees may form for short-term purposes. Again, THN is the COC collaborative applicant and COC HMIS lead. Our official COC selected HMIS system is Client Track. We have to have that in our charter. And THN currently serves as the COC lead agency and provides staff support. So those are all the groups represented in the governance structure. Another piece of our charter that's required, and for a very good reason, is a code of conduct, conflict of interest, and recusal process. And what that is all about is ensuring that those folks who are serving on the board and anybody representing the board If they have a conflict of interest over an issue, they must recuse themselves from voting on that issue. So we want to make sure that we are being transparent and giving lots of fair opportunities for people to participate and to understand how decisions are being made without any conflicts of interest that we don't know about. All right, the next section is where we as a COC are agreeing to comply with all the COC and HMIS regulations and requirements. And the last section just talks about how this charter will be approved, how we will review it at least annually, and how it can be updated at any board meeting and voted on by a simple majority of members who are present and determined eligible to vote. And we've got some appendices, some things you've already seen: Texas Balance of State COC map, the membership chart, the memorandum of understanding for the lead agency, which we'll go over in a few minutes, the HMIS governance charter, which is actually currently being updated, so it's not included right now, and the BOS COC policies and procedures, which are not finished yet either. Those are all of the how we do what we do in the COC. So we have started on those, but they are far from finished, so we don't actually have those attached, but those will become an official appendix to the governance charter when we've finished them and our board has voted on them. So one chart I did want to point out, you've seen this Balance of State COC map where all the counties in orange. And a little bit of a different way to think about the COC is what we call the membership chart. And this is similar to the one that Eric showed you about THN and Balance of State, where the largest grouping is the COC general membership. That's where all people fall into that category. Then from that category, anybody may serve on committees. And then anybody who's serving on committees would be serving at the request and invitation of the coalition representatives. And then those coalition representatives pass things back and forth to the board for official voting. So just kind of subgroupings of all of our membership is represented in this chart. So that, and you'll see these other appendices are listed, but they are not yet included. They're being updated or written. And so that is a quick run through the governance charter that we all are, you all are eligible to vote for today.
Yeah, and before we get to the vote, like I said, I would like to give you some time to ask questions or make comment about this if you have any. And I want to point one thing out that Mary went over. If you'll notice, as she went through, she went over the COC board makeup, and I just want to make sure that everyone understands that relationship, the COC board and the coalition representative planning group, and our intention with that proposed structure. As I stated last month, our intention with this is to put as much of the decision-making power in your hands as COC members. And one thing you may notice that's different from the governance structure we work under right now, and that major difference is that THN doesn't have a place on that board. Now, obviously, we are the COC lead, and we will be involved with facilitating the meetings and conducting the duties of operating the COC and facilitating planning, but we are not going to occupy a seat on the board and participate as a voting member under this proposed governance structure. So I think that's important to point out. We feel like this proposed governance structure is more in line with what HUD has asked COCs to use for their decisions and the creation of policies and procedures. So looks like we have one comment here, and Michelle Wormley with Women Inc. She's asked if we can email a copy of the Code of Conduct. I'm sorry, the Code of Ethics and Conflict of Interest documents. And she said she may need to update the Code of Ethics. So yeah, we can do that. We'll send that to you. Melinda Conway Vaughn, who is with Wesley Foundation, I'm sorry, Wesley Community Services. I know I'm getting that wrong, but she's in Corpus Christi, and they just opened up a new transitional housing program. She asked if we can approve the governance charter without the policies and procedures being completed. And I'll let you answer that, Mary, because I know you've been dealing with that question in your work.
Yes, we have talked with a HUD consultant about that. Apt Associates is a group that does a lot of consulting with HUD. They have encouraged us to, in fact, have the policies and procedures written, but that doesn't preclude us or the members from voting on this much of the charter. The caveat is, and we would certainly do this, we wouldn't include any appendices or any changes to this language of the charter until the board approves something in the future. So for example, when we get a set of policies and procedures written, they wouldn't automatically be added to this charter. They would be sent to the COC board for a vote after probably a public comment period like we did with this kind of skeleton of the charter before they become incorporated into the charter. So yes, the word we've gotten is that we can in fact have the COC members vote to adopt this portion of the charter even though the policies and procedures aren't included yet.
Sorry. Okay, and we have a question from Scott Heiser, who is in San Angelo. He asked, who nominates the people for the Continuum of Care Board? And if you want to take a crack at this, I'll let you know we were talking about it right before the meeting.
Yes. The way that we have this designed is if this charter is approved today, the current board members of the COC will still be serving as COC board members until the new board members are elected in October. We, as the COC lead agency, have offered to develop a process for electing the board members, and included in that process would be a way that people could be sort of nominated to be on the ballot for election. But that process would also come to the COC board for a vote before THN would act on anything. In general, we would hope that the local coalitions, really any member of the COC that's interested in nominating someone for the COC board within the process that the current COC board approves for election, or actually that may be the whole general membership approves for the election of board members. We would incorporate ways that people could, any member of the COC could nominate someone to be on the ballot for election as a COC board member.
Yes, that's correct. And when we do meet in October, hopefully we're ready for the full COC membership to vote on those nominated board members. And we can get that board in place. Until then, we will have a transition period. And like Mary said, we have a current board that we're proposing remains in place through that transition period to get us to that point in October when we can elect a new COC board. And that's actually one of the things we'll vote on in a few minutes. So are there any other questions before we open the vote? Okay, there is a question here. Andrea Wilson asked, would the 11-member COC board be geographically diverse to avoid any one area from being overrepresented? And of course you guys are asking all the questions that Mary and I thought about just prior to this meeting. So if you'll notice, I actually don't have access to show you, to highlight this, but on the page that Mary is showing right now on the proposed governance charter, we have, under the second bullet, there's a listing of 5 representatives who serve on what I'm now calling, to erase any of my confusion, the Coalition Representative Planning Group. Now, within that group, we would have the freedom to look at nominating people from certain geographic areas. And when I say we, I mean the COC would have the freedom of looking at who has been nominated already and identifying those areas of the state that aren't represented, and utilizing these 5 slots to recruit people from certain areas so we will have representation for that particular area in the COC board. And well, yeah, in the COC board, and so we have a fair decision making process. And it looks like Mary has highlighted all of that pertinent information there.
Well, and just to point, these are excellent questions. We have thought of many of these ourselves, and I know not all the details are written in the charter. Certainly, if you guys as members want to have things more spelled out in the charter, we could do that now. Eric will talk a little bit more about next steps, but maybe now is a good time to touch on that. What we envision happening between now and the October elections is that we on staff would propose for public comment and board vote a definition of what is a coalition, so that the local communities can know, oh, does our planning group meet the definition of coalition for the purposes of having a representative to the COC. And then the coalitions would in fact elect their representatives to the COC, and then we on staff would propose a board member election process that the general membership would vote on and hopefully approve, and then we would put that process in place, as Eric said, in time for your vote at the October meeting. And that would have everything from, announcing everywhere we can possibly think of that we're taking nominations for the COC board members, asking you all on your local level to submit names of people that you would like to be on the ballot, that sort of thing. So we definitely want it to be a process over the next few months of working with you all and getting your ideas and just us doing the legwork on how you want to see this whole governance structure develop and really start working within our COC.
So, Andrea, does that answer your question, or was that clear as mud? And are there any other questions before we move on? Okay. She said it was clear enough. So I hope it was for everyone else. If there are no other questions or comments, I would like to put this to a vote. And before we do this, let me tell you two things. We're going to leave the voting mechanism up for 1 minute, and everyone should vote as soon as they can. And number two, if you're from a community that is not in the Texas Balance of State, please do not vote on this issue for the COC board. I'm sorry, for the COC governance charter. I don't see anyone who's not in the Texas Balance of State that has joined us, but just in case any of you are from another COC, please refrain from voting. But the rest of you, please vote. And I'm going to open that poll right now. So, okay, you should see the poll on your screen. So, in 1 minute, we're going to close this. So go ahead and start your voting.
Eric, I'm still seeing my screen.
I'm sorry, y'all. I don't know what's going on. Let me see. You must just not be able to see it as a panelist.
Okay.
Because people are voting.
Great.
Okay, we already have 76% of you who have voted, so we're moving along pretty fast here. Thank you. Okay, I'll give you about 5 more seconds. I'll give everyone a little bit longer than that, just in case they need it. Okay, looks like over 80% of you have voted, and it's pretty clear. So of those who voted, 98% voted yes to approve the proposed governance charter as written. Obviously with the qualifications that the things Mary talked about working on, we will work on. So thank you all for voting on that. I'm going to go ahead and make sure the agenda's up. Okay, so that is the first item that we're voting on. The second one is the MOU for the COC lead agency, and it's the MOU between our Texas Balance of State Continuum of Care Board and our Texas Homeless Network Board. And let me just state that our Texas Homeless Network Board met last month, and they voted to approve this MOU. They signed it. So now it comes to our COC membership, actually, for vote. So I'm going to, do you have anything that I need to pass the screen to you for, Mary, or you already have it actually up?
I do not have it up. Let me get to it.
Okay, there you go. I see it.
All right. Yes, so...
Oh, hold on just a second before we move on. Bahia Nightingale asked, would it be appropriate or possible to ask folks to discuss why they voted against this? Now that's just 2% of you, and what we're talking about is voting against the last item. If you do want to say why you voted against, you can write in. Otherwise, it can be anonymous. So, so just write into me, and we may share that. But I'm going to let Mary move on with the MOU discussion right now.
All right. So again, this is somewhat of a piece of the governance charter. We actually adopted this idea from the Houston Coalition, And the purpose of having this document is to confirm agreements between the Texas BOS COC, which is all of you, and Texas Homeless Network related to the role of THN as the lead agency for the COC. So again, a way to just spell out, okay, what is the COC and the COC board expecting from THN as the lead agency, and then what is the THN board expecting from ourselves as the COC lead agency, just so that we're all very clear and in agreement on what our duties are and what you all can expect from us and what the THN board can expect from us. So let me pull it up. And you'll see again, I have updated it slightly from the one that was posted on our website for public comment. But in general, like I said, the purpose and background is exactly what I just said. Really outlines clearly what THN will do as the lead agency for the COC. We do have a date provision in this one that, if approved, this first version will be in effect from April 1st of this year through August 31st. And then we'll review it again. It says we'll renew automatically for 12-month periods following our fiscal year, but I think for this first year we would certainly bring the MOU back to the board, COC board, for their approval as well. Just a little bit about what a COC is required to do, what is a COC, and you'll see on this one I did remember to update it to 216 counties, as you'll see in yellow there. THN is designated as the collaborative applicant and the lead agency. Our HMIS, we're also the HMIS lead agency. Some general understandings about what the HUD COC program is, that the COC authorizes THN to manage the HMIS consistent with all HUD requirements. A lot of this is just our official documentation of agreeing to carry out what HUD is requiring of COCs. Specific responsibilities here are those that are the COC's responsibilities, and you'll see there are things like working to secure the funds and resources needed for the THN to do the work of the lead agency, to develop and follow and update annually a governance charter for the COC, which you guys will do with our help, establish a COC board to act on your behalf, which you have a current board but will be, now that you've approved the new charter, we'll be electing a new board in October, and so on and so forth. Just, again, spelling out the nuts and bolts of what HUD requires from a COC and how the COC expects THN to fulfill those duties. And then here is the section that says what THN agrees to do, which is in general to serve as the lead agency and staff support. And we have all these duties related to COC planning, to assisting the COC board and the coalition representative group. Again, we've just tried to outline everything that we as a lead agency would be able to help the COC with and have both boards agree on it. How we would work with standing committees and ad hoc committees, how we would do the COC program application, how we serve as the HMIS lead agency, how we do the point-in-time count and the housing inventory and needs assessment, how we do the COC program evaluation, and collaborating with ESG recipients, which is also one of those HUD requirements, and the lovely miscellaneous other duties as assigned. And there are references throughout this document to this lead agency annual work plan. That will be a responsibility of THN to propose to the THN board and the COC board under this MOU every year an annual work plan with very specific activities and deliverables that you all as COC members can hold us accountable to as your COC lead agency. This MOU may be amended, and it may terminate at a date prior to the renewal date, given 120 days notice, and then it's signed by both THN and the COC board chairs. And as Eric said, the THN board, in fact, approved this, and so now we are bringing it to you for your approval. I skimmed through that very quickly. I hope if you are interested in that, that you've had some time to look at the one that was posted online.
So any questions about the MOU between the Texas Balance of State COC and the Texas Homeless Network? While you decide whether or not you're writing in, I did clear up the question about the vote of no to the last item, and it was just an accidental vote of no. So that's it. So let's go ahead and launch this vote, and we'll handle it the same way we did the last one. So this is the vote on approving the MOU that Mary just went over. In 1 minute, I will close it. So go ahead and log your vote. Okay, looks like nearly everyone has already voted. But we'll leave it open a few more seconds. Okay, looks like everyone has voted, and everyone voted yes. It's 100% say yay to this item. So thank you everyone for voting. I'm going to go ahead and close that right now and bring the agenda back up. And so the last thing that we need to vote on, and this is something that we just put up on the agenda, and I'm sorry for the lateness of doing that, but we were talking about this prior to the meeting, and we thought we should get you to vote on this. And this is simply voting on whether or not to keep the current COC board in place through this transition. So keep them in place until we're able to vote on our COC board, our new COC board in October. So I'm just going to ask if there are any questions about this or concerns about this right now, and if they're not, then I'm going to go ahead and take a vote. Before I do that, though, I should point out who is on the board. Right now, the board is made up of 7 members, I believe. Let me make sure of that. I'm a member. Tracy Sepulveda from Longview is one of our members. Christina Folsom from Tyler is one of the COC board members. Sandra Moore from Bay City is another one. We have Carol Gresham from Mount Pleasant. She is our 5th member. Kelly Stallings from Comal County and New Braunfels is our 6th member. And I'm not sure why I always forget our 7th member. Let me pull that up.
Jennifer Laurent.
Yes, of course, Jennifer Laurent from Texarkana. Those are our 7 members. So, any questions or comments on this before we take a vote? This is, again, just to keep the board in place through the transition. Okay, I'm not seeing any concerns, so I'm going to go ahead and launch that too. We'll do it the same way we did the last 2. So you should be seeing that voting mechanism up. So please vote within a minute. I know you all need to get back to your busy days, so once this vote is over, we'll finish up pretty quickly. Okay, actually it looks like everyone has already voted. There might be a few votes out there, but 84% of you have voted, and I know there's a certain percentage of people on that are THN staff, so that may be 100%. Oh, looks like 87 have voted. So that's probably everyone. Everyone voted to keep the board, the current board, in place through the transition period. So that is approved. So thank you again for voting. Okay, I'm going to get back to the agenda, and we'll close out this meeting. So the next steps after this full general membership meeting, we'll continue to meet monthly, and everyone who's on this call, please come to our monthly meetings and participate in our monthly meetings. You're all free to come to those meetings, and you're very welcome to come to those meetings, so please continue to come, whether it's a full membership meeting or not. The next thing we'll be working with you on, well, there's a lot of things we'll be working with you on, but one of the very next things we'll be working with you on is defining what a coalition is. And whenever I say coalition, I mean all of your local planning groups, whether they're named alliance, consortium, network, or coalition. When I say homeless coalition, I'm referring to all of those groups, any group that is working working on plans to end homelessness. So what we're going to do is start defining what makes up a coalition, how often they need to meet, what makes up the various types of coalitions. So what's a small local homeless coalition? What's a medium-sized local homeless coalition? And what's a large local homeless coalition? So that's something we're going to be asking you for guidance on. We're going to be presenting ideas to you and getting your edits to those ideas and ultimately your approval and disapproval of those ideas, so we can establish that. Then we'll move on from there and start establishing what a community representative, a coalition representative is, and we'll continue to work on the governance items. So I know many of you need to get out of here, so I'm going to go ahead and just open it up one more time for questions and answers. And if you have to go ahead and log off, and thank you for participating. And again, come next month and participate again with us. So I will stick around if you have questions, but if not, go ahead and get back to your busy day. Oh, actually, Craig, on our staff here, Craig Fierro, he points out that we need to tell you when the next meeting is. So the next meeting is on April, Mary, you might need to help me out with this. Let's see. April
22nd.
April 22nd. So you will receive notice of that, and on our website you can find information like that. Let's see. I'll pull it up real quick. So you can always find our list of meetings here on our COC board membership, and you can find a lot of materials on our resources page. So it looks like there aren't any questions coming in, so again, if you need to go, thanks for joining us, and have a great rest of your week. And we'll stick around for a few more minutes to answer questions.
Yes, thank you, everyone.